Reminding you of the importance of early detection during this Breast Cancer Awareness Month and beyond this month. But right now, why treatment for breast cancer is now improving, going beyond the old and harsh chemotherapy.
Oncology Dr. Erica Stringer-Reeser is not just knowledgeable about breast cancer research, she is director of the breast cancer program at UAB's O'Neal Comprehensive Cancer Center. We came to her to find out advancements extending your chances of survival after a breast cancer diagnosis. It doesn't necessarily mean the old chemotherapy.
But now we have more targeted therapies that specifically treat and target maybe a protein on that tumor to effectively kill the tumor and stop the growth of the cells.
These new targeted therapies also improve your quality of life during treatment, even for the most aggressive tumors.
For instance, we have HER2 targeted therapy that specifically blocks the HER2 protein and kills the tumor off. We also have antibody drug conjugates, which is basically adding a GPS system to a chemotherapy. And so that chemotherapy directly goes to the cancer cells and avoids those healthy cells.
That can mean less side effects.
Patients certainly have less nausea, and some of these medications can be given by mouth instead of IV, so that shortens the amount of time that they're in the clinic, and they can get back to, some things that they love to do with their family members.
Let's talk about this test people can take online that's free to give them some indication of their risk of getting breast cancer.
It's called the Gail Risk Model, which helps you evaluate your chances of a diagnosis over the next 5 years. The free online test asks questions about your medical history, demographics, and your family history.
And when you get those results, you can share them with your healthcare provider, and then you guys can navigate a more personalized approach to your healthcare. So if that risk is high or greater than 1.67%, this can alert the doctors to perhaps talk to the patient about more screening modalities outside of annual mammograms.
Now, when you log on to the Gail model, there is a warning that the lapse in government funding could actually impact the agency's response to any questions you might have. But we also asked the doctor about why so many younger people are getting diagnosed with breast cancer and if there are any environmental reasons. She says researchers are looking at all of that, and of course funding can impact those outcomes as well.